back in the 80s, I graduated from Kansas State University. I got a bachelor's degree in sociology. I was a world class in track and field. And then around the 90s, right around the early 90s, I went through a divorce. And in that process of the divorce, my dad died in my arms. And then my whole attitude changed.
It is absolutely critical that Trilogy clients have good access to integrated healthcare services, to occupational therapy services, and to supported employment. It allows the providers to talk to one another so that they can provide the best care as a team.
What's so special about Trilogy is the fact that we do provide all of these services under one roof, with providers who work really closely together, collaborating on each individual's care, tailored for that individual. So the fact that you can come into one clinic, see your psychiatrist, see your family physician, get some wellness, talk to the nurse about your medications, go across to the pharmacy, meet the pharmacist, it's amazing, and it is essential for the quality of care that we provide to these patients.
I contacted Trilogy. I wrote a letter and said, I'm coming out, can you set me an appointment? Excuse me, it's happy tears, believe me. I see my psych doctor, I see him once or twice a month, and all my medications are convenient. They're right here in the facility. Trilogy Mental Health Services at the facility.
Now that we have an on-site pharmacy, it's easier for us to coordinate care. If there are questions about the client's prescriptions, our pharmacist walks right over and talks with the prescriber.
It is very much a team here. The doctors, the nurses at the clinic, the nurses on the teams, the recovery counselors, they all work together, and our number one goal is to make sure that the clients are being well taken care of, that they have an opportunity to access care.
My whole life has changed.
Many different clients within Trilogy are being referred to occupational therapy from the primary care providers in psychiatry who have realized what the scope of practice for OT is and have identified clients that really would benefit from nutrition planning, cooking, incorporating exercise into daily routine, or maybe they're experiencing increased risk of falls.
Many of our clients are moving out of nursing homes where they have been institutionalized literally for decades, and they do not have any experience cooking for themselves, cleaning for themselves, navigating the neighborhoods. And our occupational therapists work one-on-one with the clients to really help them be able to do these things successfully.
The skills I'm working on with Jamie, I'm doing cooking, clean the apartment, and make tea.
We are providing care for clients on recovery services, CST, ACT, clients that are getting ready to move out of nursing homes through the Williams and Colbert consent decrees.
It makes me feel good, you know, I socialize a little bit. I don't want to talk to strangers very much, but like I want to do shopping on my own when I get out of the nursing home, and I want to learn more about people and stuff like that, what other people maybe say, and things like that.
There are some people that are already living in the community that are struggling with some of these daily living skills. OT in this setting it just makes so much sense, and I think it's really important.
Employment is one of the most transformative aspects of anyone's life, and our employment specialists are very, very dedicated to helping our clients find whatever level of employment they seek.
Supportive employment is helping individuals based on the IPS model, Individual Placement and Support. It's from Dartmouth. It helps individuals find work based on their preferences, their skills, and their strengths.
See, I was real sick. I remember I had my nervous breakdown, you know, and I didn't take care of myself. I didn't take care of my apartment. I was very ill, very ill. I participated in many types of group therapy, and now I clean every day, and I do my laundry, keep my home nice and clean, and I have friends over for cake and coffee, and it just took so many years get back into a normal lifestyle.
The first time I got to meet Patty, I met her with her recovery counselor at Trilogy. We got to talk about her skills, her strengths, what's motivating her to work, and her preferences. And then on, we started meeting out in the community, and that's where I got to learn a little bit more about Patty and what she's truly looking for in her dream job.
Well, I was working with Megan, and we just kept working at it for like 4 months.
And that's when we got to go out and meet other employers such as Walmart and went through the application process, and I worked with her one-on-one on filling out the application, going out to Walmart and job developing them.
And then finally there was a job opening and they gave me that opportunity.
The best thing about IPS is that anybody that wants to work can work, regardless of any barriers that they have. Our job as the supportive employment program is to be their advocates when going out into the community and breaking down the barriers of stigma. One of the first things that when you meet somebody, they ask you, what do you do? And clients are now being able to say, I do this. This is part of me. It's giving them an identity.
Most of our clients at Trilogy don't have a treatment team of one. They have a team of treatment providers from all around the agency to help provide them with the best services possible. And these providers actively communicate with one another to make sure that they are doing this as a team and that everyone on the team knows what's going on with that client and how to best provide them with services.